Welcome, everyone, and happy Social Work Month. The theme this year, Bringing Change to Life, recognizes and celebrates the differences social workers make in the lives of people, families, and communities across the country. My name is Annette Johns, and I'm the Associate Director of Policy and Practice with the Newfoundland and Labrador Association of Social Workers. I have the honor of being the moderator for today's education event titled, Before Cannabis Becomes Legal, Social Work Practice Within a Changing Drug Culture. Regardless of your area of practice, this is a topic that is certainly relevant to us all and timely given that legalization of cannabis is anticipated this summer. As social workers, we have a responsibility to learn about cannabis and the impact on one's health and social well-being. The country is having these conversations, and as a profession, we need to be having them as well. This webinar is a collaboration between the Newfoundland and Labrador Association of Social Workers and the Canadian Association of Social Workers. It is exciting to note that we have hundreds of social workers from across Newfoundland and Labrador and throughout Canada tuning in today. The webinar presentation will be approximately 60 minutes, followed by a 30-minute question and answer period that I will moderate. Please send in your questions throughout the presentation. Only myself and the presenter will see these questions. All of the housekeeping details you need, like how to access the recording and where to download the slides and how to get your certificate of attendance, are all included in the housekeeping widget that popped up when you first logged in. So I now want to introduce our speaker for our event. Troy Mitchell is a registered social worker with a Bachelor of Social Work and a Master of Health Studies. For the past 20 years, he has worked within the area of mental health and addictions from the perspectives of clinical practice, provincial policy, and quality and risk management. He regularly monitors trends in the field, and I'm certainly looking forward to his presentation today. So without further ado, I will now pass things over to Troy to begin the presentation.
Hi there, folks. It's Troy Mitchell. Thanks so much for tuning in, and thanks to both NLISW and CISW for the opportunity. It's a very timely topic, lots of discussion around it, and as a social worker, I believe that we, this profession, are they. In terms of when people say, what do they think? I think we're the ideal profession because for all of us, all of our areas and all of our clients will likely in some way be touched by cannabis use. Thanks to all of you that are maybe giving up your morning. So those that are far away, Newfoundland Labrador is 1:30 p.m. in the afternoon, but I know some that are, as we get further west, are further away, so thanks for tuning in. We're going to kind of look at, where we've been and where we are, some of the rationale for legalization, what they are saying, look at some other jurisdictions. The workplace is really important. I was just talking with Annette a moment ago about the fact that when I speak to major employers now, there are even if there are policies in place regarding cannabis, there's still many technical details yet to be worked out. And detection and its relation to addiction will also be brought up. I'm going to talk a little about big doses and small doses. If you're from Canada and maybe from the West Coast, the talk throughout North America has been about BC bud and increased levels of THC. The small doses will also become a part of this process, and we'll talk a bit about your practice. No matter where you're sitting today, more than likely someone within your area has medically prescribed marijuana, and interacting with you or around you or near you, someone is enjoying a small dose during the day of CBD, which has no effects, no psychoactive effects, and are using as a relaxant or pain mitigation throughout the day, and are also prescribed THC in the evenings, which will bring on potential euphoria, depends on the dose, but also ease and sleep. So that wide range is there in that there are folks who are actively using medical marijuana who are among our colleagues and profession who are saying, finally, let's get this going. And there are also folks out there who this is a dramatic change in life and a dramatic change for families and workplaces. So we have a wide range that will come across our practices in the year ahead. This is the last slide I've added, and I added the slide late last week because it was only on Thursday of last week the bill C-45 made it through the second reading of Senate by a vote of 44 to 29. So even though for those of us who've been watching this in Canada, we can think that, yeah, of course, that was a no-brainer, that was going to happen. If the vote had gone the other way, today's presentation would be when cannabis almost became legal. We have a very different tone. But it passed through. The second reading is important. It sends any bill to committee, and it really paves the way to legalization and maybe that anticipated late summer, early fall time frame. So that's a very new development that we've been kind of watching for in terms of next steps. Your first poll's on the screen, and it's a chance for us to see kind of where you guys stand to the question, your personal reaction to legalized cannabis. Give you a few moments to figure out where you are. And Annette and I will get to see sort of your results in the next 15 seconds or so, kind of telling us where the group online are at the moment. It's as wide-ranging as we think it may be. Finally, it's time to legalize. Still undecided, or I disagree. This will create issues. Early running is in. Close, actually. Finally, it's time to legalize. Almost hits 48% of you. Still undecided is 36.5%, and I disagree. This will create issues, 15%. So absolutely, it's great. Thanks for weighing in, by the way, folks. It's great to have your votes on that, and it's nice for Annette and I to know kind of where you are. And I'm thinking as I talk with people in the community and employers and organizations, people are following very close to there. In fact, I think that the conversation is focused so heavily on the purchasing options and money options and tax options that for a lot of folks who haven't even who've been waiting for a while for cannabis to become legal, the legalization is now an afterthought. Let's just move ahead with how we're going to distribute and what we're going to earn and who's going to get to sell. So, and I think that, so there are a lot of folks who are rightly saying, yeah, I've had a look at this, I've worked with clients, or I've been around it, and legalization is the right way to be. Still undecideds are throughout our profession and throughout the population in that, like anything, alcohol is also legal. But for those of us that work with addiction or with clients that are not, that encounter issues with substance use, there is concerns about what's to face with that. So wherever you sit in Canada at the moment, you've probably been around a whole cultural dialogue about who uses, who sells, the risks, rewards. If you're a loser, if you're cool, druggie, a stoner, a narc, if you're in that crowd, stereotypes and programs. Wherever we've been, that is often been a dividing line. And in fact, for some families and for some areas, it's been the crowd that do no substances, sometimes the crowd who drink but don't do drugs, and the crowd who do drugs, that crowd. And we've had a lot of years of this, every one of us, those in our personal lives, in our professional lives. And I think that the nation hasn't quite prepared for that shift in culture, which causes multiple generations being asked to shift very quickly next fall. We've probably all have been around or know of families where people have parted ways, where someone said, you're not doing that under my roof, and you're leaving. And folks have moved out over this topic alone. And I've certainly in my practice over the years have known people that have said, parents who've openly said, I'm okay with drinking, but as long as they don't do drugs. That's been the dividing line. So starting this fall, it's all going to be intermingled as all legal products. So those of you that were at Woodstock, those tiny number of you maybe that were at Woodstock, may have seen this young lady being tossed on a blanket at Woodstock. I've always been sort of amazed at Woodstock because there was a time in America and in Canada of major shift, major drive by young adults, and at a time when marijuana use seemed very permissive, And I've often considered like what's happened in the time since then, that those years in between 1969 and today, when we've had varying responses to that culture and to the war on drugs in the U.S. that spread into Canada. But it's certainly something for us because anybody living in 2018 can't help but be still exposed to the music and the history and culture of the 1960s and 70s. This reality has been part of our reality from a pop culture perspective all of our lives. And images like these are throughout our pop culture. Related products and how they're used and related music is spread throughout our culture. It's absolutely there. And that makes it even especially easier for us now to step over the line from illegal to legal because it's been there for so long. Okay. Poll number 2. There are brand names of weed. Which of the following is not a brand on allbud.com's 10 highest THC cannabis strains of 2017? So the options are Gorilla Glue, Strawberry Cough, Incredible Hulk, or Panama Green. Which one is not a brand? You guys are awesome. You guys are awesome. Hitting exactly where I thought initially. The one that is not a brand is Panama Green. Gorilla Glue, Strawberry Cough, Incredible Hulk are all strains of cannabis, all available products. So it will really be interesting to see as things get packaged up, as we move forward and we get used to seeing cannabis as products, the way we see alcohol as products. It'll be interesting to see if in a year or two you actually get to see some of these brands on the shelf somewhere. Panama Green, not a product, even though I thought it was. It was my invention, and I thought that makes an awesome name. So no matter what population you serve, you're serving 13-year-olds or 74-year-olds or beyond. It's possible that new realities of cannabis will become your new reality. Earlier, I reflected back to Woodstock, which was 49 years ago. Imagine that a 25-year-old Dan having the best time ever is now 74 years old. So we can make the leap to think, of course, 25-year-olds today in 2018 probably use cannabis for some of them in the way alcohol is currently being used. But what if we have 74-year-olds or 70-year-olds or 83-year-olds who use cannabis back in the day and for numerous reasons, work, career, family, legal implications, backed away. And if they're your client and they're in their 70s and now return again to cannabis because the barrier was the legal aspect. Now if they return and say, you know what, it was always awesome. Back then I loved it, but I was fearful of getting a criminal charge. So if you're working with seniors who are finding themselves with a variety of medications, if cannabis is available in a store like alcohol is, your client who's a senior may be picking up cannabis, and that may become part of their life, which may bring up personal complications, may bring up complications with family, or alternately, it may be the best thing ever. Someone may replace their pain medication with cannabis and may say to you as their client, finally, I didn't enjoy taking those pills. I actually have some pain mitigation. I have some sense of relaxation from cannabis. And for us as social workers, it's nice for us to be ready for all aspects of that conversation. Just gonna have a drink of water, folks. So even when we think we're ready, it feels like we're ready. The date on this piece of news was March the 10th. So even as recently as March the 10th, there are folks who do wonder again about what's coming next, and are we really ready? Are we in the dark? So there is funding just recently announced about preparing for health outcomes related to cannabis. So we are motoring ahead as earlier with the Senate decision recently, the Senate vote. But just like any other chemical that's going to be able to be purchased, the effects on individuals and the population still being researched. So don't be surprised in the next weeks and months ahead to see articles that swing both ways. A swing on the side of finally this is happening, this is awesome, and swinging to there are new concerns. This is too fast. We haven't got our work done. The federal government hasn't rolled out the initiatives that it talked about. So don't be surprised to hear swings both ways, and let that guide your perspective. So what are we doing at the moment? This is this presentation originally was geared at Newfoundland Labrador. Some of my stats are Newfoundland Labrador. In Newfoundland Labrador in 2012, 30% of Newfoundland Labrador students in the past year had used cannabis. The age of first use was 14.2, which was up from the previous student drug use survey. I believe each province, I know the Atlantic region have the same survey, and maybe the rest of Canada does as well. This most recent 2015 survey on the bottom there is the Canadian Tobacco, Drug, and Alcohol survey, which showed 12% of all adults used cannabis in the past year. Highest, of course, in those aged 20 to 24. So at the moment, there's just under 1/3 of us, 1/3 of young people, and this is pre-legal. I know the young folks I've spoken with in recent years who use are, especially with legalization on the horizon, have felt less threatened by the legal side, and have felt very little pressure from the social side in terms of, should I be doing this? I feel bad. I've heard very little of I feel bad in recent years when I've talked to young adults or teens. With adults particularly, it's been more about, I'm okay with this, but it has implications for my life and my career. Even though I've talked with folks who their addiction is primarily cannabis and have sought service primarily for cannabis. And a lot of folks have weighed in. Canadian Association of Social Workers, the Canadian Psychological Association, Canadian Medical Association, Canadian Nursing Association, and many, many others have weighed in with, okay, so we know it's coming. Let's make sure to do this. A public health approach is a very common approach that's threaded among organizations who are speaking on this topic, along with prevention and awareness, increased options for assessment and treatment, and harm reduction. So I am seeing, it'd be interesting for you to look among your colleagues and to look in your communities about what you're seeing in terms of the public health approach that's happening at the moment preventatively, and what you may see happen over the next year. I've spoken recently to companies and to school systems about their preventative approaches, and I get the feeling that people believe they're there and they're getting ready, but don't get much feedback on what they're actually doing. Hard, measurable decisions, but I know that nationwide there is a planned rollout of awareness that's been built into this legalization measure. So the full swing is there. Anticipation, excitement, finally, it's here. All this talking. In Newfoundland and Labrador, there's a lot of talk about business, licensing, taxes, money. Happens a lot. So I feel in the past year it helped people move, accepting the idea quickly, and really focus on media reports, particularly on what are we doing now that is legal. Who's going to benefit? How are we going to get it? What are the limits? And there are some folks who've been on anxiety or depression medications who are on them and would like to try something new, or on them and don't like the feeling when they're on them, or have been on them before and can't stand SSRIs, and are saying to their clinicians, finally, cannabis, finally, I'm going with that. I can't wait. That is absolutely there. Also, there are dire predictions that this is the biggest drug change in many years, probably the biggest change since Prohibition back in the day. More children will end up using the drug because just like a young person can get alcohol now by getting someone older to buy it, it will happen the same with cannabis. That's the dire predictions. And there are dire predictions that drivers who use cannabis will be on the roadways and will be driving impaired. And will, even if it's someone who would normally say, I would never drive impaired, that's a dire prediction. That's going to change the way we drive. We kind of were back here a few years ago. Back in 2007, the Lancet published an article about cannabis use and psychosis. At the time, it got a significant amount of media attention, a lot of pushback from the pro-licensing folks even back 11 years ago, and some weight by the addictions, mental health community to say, there, finally, we know that cannabis has an impact on our clients. So that was back in the day, 2007. Most recently, heading towards legalization, organizations like the Canadian Centre on Substance Abuse really put a lens on really the negative aspects of criminalized cannabis and the opportunities ahead by not having it illegal any longer. So that was a push we saw back in the 2012, 2013, 2014. It really opened the door for people to hear folks who are working with people who use substances and the negative impacts, and really nudge towards this harm reduction approach of recognize our clients for their choices without those choices necessarily getting them the legal route. So, better than store-bought. So, like any illegal business, it's not necessarily that cannabis becomes legal and all illegal sales will disappear. People who are making money illegally will continue to make money illegally. So there are just new products. There's a high-bred brand of cannabis called Skunk that has 2 or 3 times more the active ingredients of the usual cannabis. So there probably will be discussion once this hits store shelves among the illegal community that what you're buying is a controlled, known level of THC in every package. If you want the real stuff, come to me and I'll get you the real stuff, which is more potent. So that probably will not go away. That probably will stay with us. And likewise, really high potency product called Shatter, which if any of you are around cannabis products over the years and know about hash oil, which is black inky substance, go to the next level, and it's a very pure, very clean extract called Shatter, in which also is just currently available in every city in the country, and will continue probably to exist, providing users with a higher potency. And folks who use cannabis regularly end up using Shatter when they want that extra push. So that probably will not be going away. There will be options available that are better than store-bought. Government of Canada has a variety of information on legalization. If you want to read that, I didn't provide the link there, but go to Government of Canada, and this is under their justice area, and you'll find information there. I just want to touch base for a moment on what the federal government is preparing. Lots of facts and lots of options to explore your own knowledge of this. Like this one. There's a cannabis talk kit. How to know how to talk with your teen. The link is there, which you'll be able to get after this presentation. But it may be a great product for those of you that are interacting with parents or school systems. free information that can be sent to the subscriber. So on one side of the coin, there is here's what we're doing, here's your information. Other side of the coin, and you'll see this grow in the months ahead. This is an article in Maclean's that talked about a conservative MP talking about, what if a kid goes next door and starts eating somebody's cannabis plant? We're allowed 4 each in our gardens. So there's a whole pushback on the fears. Cannabis will be grown everywhere. Anywhere there's green grass, there could be 4 cannabis plants. So you'll see some of the pushback from the government side on one end saying, here's what we're doing to help care for you. On the other end, the opposition side and others saying there are major issues with this that we haven't looked at yet. That is in play at the moment and will grow in the months ahead. In Newfoundland and Labrador, in recent months, it's settled into that you had to be 19 and over to buy legal cannabis. It will be available in stores. Details are forthcoming. Today is budget day in Newfoundland and Labrador. We're probably going to hear today of measures around both the legalization side, the marketing side, but also the awareness side. That's probably coming today in Newfoundland and Labrador's provincial budget. And for those of you not in Newfoundland and Labrador, the guy with the beard is Newfoundland and Labrador's Justice Minister, Andrew Parsons. To look around at where else. What happened in other places? Colorado, Washington, Alaska, Oregon, D.C. California just became legal in recent months, and these have been legal for a while, so there's a chance to kind of look at what happened there. There is the bad. Lots of articles about increase in traffic fatalities linked to marijuana use in Colorado. So that was a measure of looking back of pre-legalization and after legalization and an increase in highway fatalities. In Washington, D.C., fatal road crashes involving marijuana double. And in Oregon State, marijuana use among college students on the rise following Oregon legalization. So that's there, and there are probably 10,000 articles that have all types of variety about the bad, tons of them, more than you can read in the next month. There's the bad. There's also the not so bad. The Drug Policy Office in the United States have looked at Colorado, Washington, Alaska, or Oregon, and Washington, D.C., and indicated that early reports indicate that legalization has neither been positive or negative. It has little impact on the overall rate of youth use, and total arrests for driving under the influence have declined in Colorado and Washington. And on PBS in March of last year, there was a look there at what's happening in states, and it indicated that adolescent use was shrinking, even though as worries of addiction grow. So that is absolutely there. There are learnings from on both ends, and there's measures of truth in both ends, the bad and the not so bad. But in Canada, I know that the Canadian government did consult with several U.S. states along this journey. Here's a chart of 30-day marijuana use among Washington youth. And ironically, from 2012, when it became legal in Washington, the dip in 8th grade and 10th grade declined, slight increase in 12th grade, but not on, even in 12th grade, not on the trajectory it was before legalization. Fortunately, it was a little bump up in 6th grade, which is not so good to see, but I'm really, the 8th and 10th grade reductions are fairly significant. And these are traffic fatalities. And I can look at my notes here. There was a decline after the first year of legalized marijuana, legalized cannabis. So in this state, in some of my viewing last year, a year or two ago, it really seemed that with marijuana use, the increase in impaired driving would be significant. It's interesting seeing these three states and seeing the line, which is a generational line from 2005 to today, to 2014, sorry, continuing to decline despite the introduction of legalized cannabis. For those of you that are in workplaces or interact with workplaces, Annette and I were chatting just before I came online, and we talked about the fact that many workplaces have considered their current workplace policies in line with cannabis use and have adjusted. But when I delve into that with a bit more detail, the nitty-gritties are not quite worked out yet. What I'm finding as I speak to employers in preparing for this session. So there will be potential changes in workplace testing. So at the moment, workplaces, high-risk workplaces, test before employment, and some workplaces, any THC in the system means you don't get a job. Others test after an accident, and any THC in your system means you don't get a job. But now, if society ends up viewing cannabis in the way we view alcohol, and someone's allowed to smoke cannabis a week before, or they stop smoking a week before, it's really going to come into question of, is it that you had cannabis in your system, or is it that you were actively stoned at the time of the incident? Companies who have a lot of drivers, it's a major risk issue that I'm sure their risk managers and their insurance companies would be concerned about. Company vehicle with a company logo having a driver have an accident where the driver feels okay to smoke marijuana on their lunch break. Probably a big deal. So organizations need clear policy on what use involves, what their tolerance level is, so employees are aware of the parameters. And for those of you that work in settings where there are residents, clients, patients, or on the grounds of a building you work in, and rather than simply dealing with the smoking issue of people stepping outside your building and smoking and trying to enforce non-smoking properties, you may now find yourself being involved in ethical conversations about a person's ability to smoke and their ability to smoke on or off the grounds, and then their ability to smoke and come back to the program, maybe under influence of cannabis. So for each of you, that's probably going to be a practice implication. And for you as an employee, it will be, if you choose to smoke on your lunch break and you're smoking cannabis, that probably will be an implication for your own career that your employer may need to work out with you. So will it be the new workplace normal? Now, will people smoke marijuana before work, during the breaks, at lunch, prior to driving? And how will employers decide on impairment? And what will be the indicator before an employer says, I believe that you're under the influence? Can't smell alcohol, but something's up. Will it be a visual cue? At the moment, if you're pulled over by the police in Canada, the first step, if you seem not coherent, but you're not drinking alcohol, it's a visual determination. It's the first step for police officers, and some discussion and some physical attributes that decide, are you going to go for the next step, which is blood work or a urine test? Is it zero tolerance? Is it a urine test? So will employers get there? If someone comes to a workplace, somebody who's not a drug use expert says, I believe you're under the influence. College will have to drive. What happens then to you as an employee? And if you're a social worker supporting your client who's in that boat, what will you need to know as a social worker to be supportive to your client who's facing a major career change based on substance use? Next poll is your workplace. Has a cannabis policy approach been presented at your workplace? No. Yes for staff only. Yes for interactions with clients only. Yes for both staff and client interactions. We have a whopping 1.7% who advised us that yes for both staff and client interactions. We have a 98.3% response for no. So for you empowering social workers, you may have a role here to nudge this along and advocate, because I do believe that of all professions out there, we are more of the they than most any profession on the ground right now for driving conversations on this topic. Excuse me. So thanks for weighing in on that poll. That was really helpful, actually. It will be for all of us as social workers a shift in our interactions with families. We're expecting society to shift very quickly from don't use drugs in my house to it's legal and there may be a package on the cupboard, on the counter in your house. A major shift. And in my career, I've had many families who the presenting problem has been, I don't mind if they drink, but they're using drugs, and I don't want that in my house. That's been a standard conversation. Families and kids might be saying, I'm not high, you're high. May have households where parents are using, and it may be CBD as a relaxant or as a pain medication, and the youth using more THC, but both into a discussion of really who's the problem here. We're both using. It's legal. What's the problem? Probably will be new lessons for driving for young people. When you take the car now, that extra conversation is going to be not only don't smoke and drive, but don't have someone smoking weed in the car while you're driving, because that will also be in your system. Maybe a supply on hand in many households. And the avalanche for a year or so, 2019 I'm hearing, is edibles. When edibles hit the market, it will come in all shapes and sizes. It will change the temptation daytime for anybody that uses. And keeping in mind in 5 years, this will be a normal part of the products we see in our lives. Edibles will be a major issue as well for families and young children, because they are going to look pretty. And there will be, for those of you particularly that are involved in child protection, that probably will be part of the conversation of what's exposed in the home, and does that drive a safety conversation. But a big adjustment, not legal, war and crime, hippies, to very clinical, cool, white-coated, this is what it is. Get over it, move past the, is it good or bad? It's here, and let's do it properly. That swing is a massive one. How's the addiction on this product? New England Journal of Medicine says 9% of people who use become addicted. Treatment, our behavioral therapies are very effective. Relapse prevention, motivational interviewing, or combination along with CBT are seen to be very, very effective in working with folks who are addicted. One of the challenges, those of you who interact with some of the self-help groups like Alcoholics Anonymous will tell their colleagues, watch out for people, places, and things. If you watch out for that, that takes care of part of the strategy of moving away from your addiction. But in next year, when it comes to cannabis, legal completely changes the interactions, completely changes where the product is and the accessibility and who in your life has it. Whereas on the illegal side, it took an extra step to find product and decide where you're using it and how you're using it. With a legal product, that's going to change. It's really going to change some of the fundamental conversations about use. What about binge drinking? Newfoundland and Labrador is the highest rate of heavy drinking in Canada. In Oregon, university students who reported binge drinking were 73% more likely to also report marijuana use. So those of you listening in Newfoundland and Labrador, in the province with the highest rate of heavy drinkers, maybe be prepared that if your client is drinking heavily, cannabis will probably be in the ballpark. I've certainly in my career I've been in places where families were and communities were really really freaked out about alcohol use. And I've been at public forums and I've said to them, where the alcohol is being provided, that's where the drug dealers are going. That's an ideal market. So concerned about drug use, be concerned about the alcohol use as well. What's happening in impaired driving? Newfoundland and Labrador, for those of the rest of you in Canada, you're seeing that we also in Newfoundland and Labrador have the highest rate of police-reported drug-impaired driving among the provinces. For those of us that practice here, we also have the combination of highest rate of heavy drinkers and highest rate of police-reported drug-impaired driving. And Canada, age 20 to 24 has been the highest, both in Newfoundland and Labrador and the rest of Canada. And that's probably the fastest growing area. And if you were a police officer listening in and you are pulling over a sports car with dark windows, that might be the age group that you're probably targeting. The provinces are responding to risk. In last fall, Rationale, which is the agency in Newfoundland and Labrador that deals with driving suspensions, introduced a zero tolerance for blood alcohol concentration. And as you can see on the next on the item below, the Government of Canada is really focusing in on nanograms of THC that will indicate guilt regarding impaired driving. And a combination of THC and alcohol will also indicate impaired driving suspensions. That's going to be very, very complicated, I believe. At the moment, there's a fair number of challenges in court when people are charged with impaired driving by drugs. But that's probably, I'm predicting this fall, the new reality for news items around impaired driving will focus heavily on cannabis. Next survey. How long does cannabis last? How long after a single use of cannabis is it detectable in your system? Well, you guys are very sharp. Correct answer is 3 days, which 72% of you said. Awesome. Yes, a single use, 3 days. And of course, that will depend on what you smoke eventually, store-bought versus illegal versus potency. But absolutely, good on you. You nailed it. As I've mentioned a couple times before, it's easy for us as a profession and for the media reports to focus on youth. Youth will be absolutely impacted by the legalization of cannabis, but every single client population that we deal with will be impacted from all areas. This reflects on, actually I jumped this one ahead, this reflects on the time frames. Single use 3 days. It's the heavy users that are a month. Those are the folks who struggle when you've quit cannabis. You need to take a drug test in a couple of weeks to go to work somewhere. But heavy chronic users struggle with wondering if this is gone from my system. In drugstores, the idea of flush kits are alive and well and being used. I don't know if they're effective or not, but people absolutely buy them. They use flush kits to build what they believe is going to remove cannabis from their system, and I haven't heard if that's successful or unsuccessful. So there are guidelines in terms of use, and guidelines quote here from the Center for Addiction and Mental Health to really help cannabis users make good choices, and also a quote from the Canadian Medical Association. Indicating, of course, that just like any other product, like smoking or alcohol use, there are health risks involved, and we need to have a role in helping mitigate those risks. So I'm not sure how clearly you can see it on your screens there. Canada's lower risk cannabis use guidelines include things like there are health risks. You can avoid these by abstaining, delay taking up cannabis use until later in life, choose lower risk products, avoid burnt cannabis, and some of the others here. Limit and reduce how often you use. don't drink and drive or don't use and drive. So that's out there, I guess, this is in sort of the whole harm reduction mantra to say, so you're using. This is here. Do so to mitigate as much risk as you can. So a lot of the focus in the last 20 years has been around better and better THC level cannabis. So here's one I didn't put in my survey earlier. Girl Guide Cookies is a brand name that made the top 10 highest THC strains. And in case you're interested, it hits you with a euphoric punch and leaves you warm and relaxed for hours. It leaves you spaced out and relaxed, fighting anxiety. So a wide variety there, and amazing for each of us that in the coming years we will be reading product labels with attributes that will help us decide what we're using or help our clients decide what we're using. So maximum effect has been there. It will not go away from the illegal market. It will be there. But that's been the focus for many years of getting the best and the best and the best THC levels. Small doses is predicted to be the market in the future. There are companies, especially in the U.S. at the moment, that have really moved into a niche with parents and seniors and people that really want cannabis as part of a lifestyle, definitely about reducing pain or relaxing without the psychoactive effects. And if the U.S. is any indication, in Canada, what you'll see on your shelves, even though the THC psychoactive products will be there, for the average person that follows the U.S. model, it will be possible that this will be comparable to having a glass of red wine at the end of your day with dinner or before dinner. A real niche market. Just have a look at how beautiful it looks. 2.5, you'll actually be able to buy a brand that will just tell you how much THC or CBD is in it. It'll let you know that it's combined with green tea, zesty, refreshing flavors. And if it predicts what's happening in the U.S. now, especially in the Western U.S., you will see beautiful products. You'll know what you're getting. You'll know that the THC or CBD amount, and that may be what becomes on those shelves, just like wine. So if we move past the, oh my God, I'm freaked out, this is happening, to, okay, it's happening and will probably be normalized in 5 years, this is probably what normalized will look like. So your practice. I grabbed this list from CASW, wide variety. You work everywhere. Wherever there are human beings, we have a presence. So for any one of us, to do a focus group right now as an entire group on this phone call, and we had to brainstorm about what interventions or what impacts for our client base will this have, each of us will weigh on every single location and weigh in and say, this will have an impact. Absolutely. So that's where it is. It's each of us, and it's everywhere we work. Look at what was kind of found in some of the other U.S. Districts. In Colorado, something that may affect social workers was a change in documentation. Even though it's a small bump of 1%, in a couple of years, there was a change in the mentions of cannabis in documentation from before legalization. For social workers previously, those in addiction practice, that was written all the time. That was a presenting problem. It was a regular part of the conversation. But probably for folks who it may not have made it into all types of documentation, but it has in Colorado. So some of the potential reasons they consider for there is an increase in cannabis-related medical issues is tied to an increase in consumption, greater prevalence of use, greater willingness to report, or greater inclination among medical personnel to ask. So for those in the people profession of social work, we will probably be the folks who hear this from clients, but we'll probably be the folks who ask. And if we're asking without judgment and with genuine interest like we do with lots of topics, we'll probably allow a client to to not only explore how they're doing with the use, but also probably explore how this is impacting other parts of life, either just family systems or potential addiction. So that may be a positive change for us as social workers. Your practice. Next poll. Your practice. When talking with clients about cannabis, are you knowledgeable? So just because we're social workers and we're around people all the time, that don't mean we know all things about all topics. Okay, so a lovely 4.2% of us have never seen a joint, never seen cannabis. A quarter can recognize the smell of cannabis. Can you imagine in 5 years' time you'll recognize various brands of cannabis? 37% has seen cannabis up close, and 1/3 of us know how to roll a joint. And maybe I should have had an extra line on that sentence that said, I know how to roll a joint well. No, I'm kidding. So awesome, thanks. What a great variety. And it'll be interesting to see if we match the rest of the population or not. We're often way more likely to be exposed to variety, but that's a great variety. Thanks for weighing in on that one. So there are some really, really great resources out there. So today is just a snapshot and one perspective, and I'm going to see if these links work. And I know they're not that embedded. So the links you see there, Center for Addiction and Mental Health, absolutely drop in there. They've always been one of my go-to places to consider addiction and mental health, and there's an awesome section in there about cannabis specifically. Go there, camh.ca. The Canadian Centre on Substance Use and Addiction have an awesome section on its front page about coming of cannabis, the impact on youth. They have a brand new item there very recently. That will be on their front page. And Health Canada, if you go under canada.ca and go to Health Canada, you'll find a range of resources related to cannabis use. So there's lots out there. And the reason I want to provide these specifically is that if you type up cannabis on the internet, the first 20 hits are sort of weed culture brands. So it's really hard at first to randomly look for cannabis because you're going to find all types of, from the former days of pro-cannabis conversations that have now made it to the top of Google search. So look for some of these if you want some of the technical information. If you want to look at the conversation about the culture, hit the first thing you see on Google and you'll get to read that as well. So I had this amazing video about rolling a joint that couldn't get to play because I would have had to log in live. So in case you haven't rolled a joint and your client comes to you and says, I am awesome at rolling joints, I'm really good at it, or I'm using this, or I'm using this much product, or I roll really fat joints or really skinny joints. If you haven't seen one rolled, at least let's talk about the beginnings. Papers, glue strip facing down is a big deal, and filled up or don't fill it up. And I believe that the person rolling this joint is the Grinch, by the way, just in case you're wondering. Step 2, how to place it in your hands, how to roll it back and forth, how to get it in there nice and firm, what to do with the glue strip, when to lick it, all sort of built in. And I love the dramatic. When I found this online, this is not my writing, this is some online things I found. The last sentence, this is the critical moment. Amazing. You're just about to get your joint ready and you have a critical moment in step 2 at the bottom there. Step 3, all important, when to lick it and when to roll it. Completely affects the makeup of the joint. And I suspect that some young person will explain in great detail about their expertise in rolling a joint in the year ahead. And step 4, a little formatting, getting it the right shape, because it apparently the expertise makes a difference in terms of how it's smoked. And in case any of you wondered, now you're ready to roll like the pros. So But in case you're wondering, really, if you have clients who are saying, yeah, I'm really, really good at this, go online on YouTube. You'll find these excellent videos that are not neither pro-cannabis or anti-cannabis. They're simply, so you're going to roll a joint, here's how to do it. And it'll give you some insight in terms of what your clients may be talking about. Or if you're rolling yourself, you may improve your technique. In terms of your practice, cognitive behavioral therapy really is helpful in terms of working with folks to determine their triggers and consequences of use. That style of feedback and helping them to link how they think with how they behave is really helpful. I think one of the challenges is for some folks who use cognitive behavioral therapy and use sort of an ABC approach, with B means examine your beliefs. In my career, I ask folks to examine their beliefs. They've often been able to say, I love this. I love cannabis. I love weed. But I'm really concerned about the illegal nature and what that would mean for me. So I've thought that it may be a challenge ahead. Folks don't come with that belief difference. So they may come. Motivational interviewing really puts the autonomy in the client's hands. It really looks at solutions, and it really lets the client know that you're going where they are. And if they have a goal to reduce or change, it really is effective in moving people forward. And, of course, harm reduction, a lot of the conversations around the guidelines, around low use, around care, around if you're using, how do you use and reduce the risk for your job or your driving or your family interaction. It helps a lot. And we are at the 57-minute mark.
Wonderful. Thank you so much, Troy. We're at the question and answer section there now, and we're going to do our best to get through all the questions. They've been rolling in, and I've been keeping track of them. I guess we'll start with the question, Troy, around, someone asked around how knowing how to roll a joint is relevant to our social work practice, because when I looked at the slide, it was more about, how do we understand when our clients are telling us something from a clinical perspective around understanding what our clients are telling us was more the messaging, but that's how I took it, but I'll pass it over to you as well.
That's a great question, actually. And before I put that one in, actually, I did wonder about that because it's easy not to go there. It's easy to either, one, believe that we automatically understand what our clients are talking about, or two, to think, well, this is a professional presentation, why have that in there? But if this is coming full speed towards us in the next few months, and our clients are going to be using more than we expect today, or not, it was put in there actually for some fun at the end of the presentation, but it was more about, yeah, this is coming. Clients are probably speaking to you about that exact topic.
Perfect. Thank you, Troy. Another question came in around addressing the generations that you would have spoke about at the beginning of the presentation and how we must consider effects on children and how that might look.
Yeah, just looking for the question, sorry. Yeah, I think that I think this is a wide open guessing for what, especially not necessarily this coming fall, but maybe the next couple of years of children, first of all, being are not immune to the messaging around where we are as a society. We've really been hyping the conversation about cannabis itself, but generationally, I believe there's going to be two specific sides emerge this fall. One will be the non-use perspective of the last many years versus a new generation that says it's legal. Like, what? Stop saying what you've been saying. It's now legal. But I think for children particularly, it's going to be for parents, it's going to be trying to guide their children about reducing harms while use may be happening, especially with some of the edibles some of the lower dosage options. It'll be interesting to see if we follow some of the path as alcohol, in that we've been telling youth not to drink when they're younger, but we're just surrounded by a complete drinking culture and advertisements and access. So I'm feeling that one's very wide open heading to the fall.
Thank you. In terms of this question is more related to driving, I guess. Do you know through research and review if Canada has looked into identifying cannabis use, when a person's over the limit through tongue swabs right there at roadside, or how they might be doing that, because as other countries have also looked at that or are doing that?
Thank you. That's a great question. Actually, I had a conversation with the police last week on this topic, and swabs are coming. They'll be coming this year. I believe they've been trialed in the past several months. At the moment, at least in Newfoundland and Labrador, if folks are appearing to be under the influence, there's a physical sort of assessment, a conversational assessment by the police officer who makes a determination if the person should go for blood or urine samples. If the person says, I'm not doing that, they're automatically charged with impaired driving, and that charge will stick. But the officer I spoke with last week said that swabs are coming to allow officers to make a determination at roadside, which will determine is a person in an acceptable limit to drive away, or are they to a point where the 24-hour suspension, or does it indicate that they need to go for the urine and blood test to see if it's an impaired driving criminal code charge.
Wonderful. And still lots of questions coming in, Troy, so we got lots of time. So keep those coming in. In terms of, there's a couple questions here related to child protection, so I'll maybe separate them out. Someone was saying that the reality in child protection is that there may be issues with drug use in the parental home, which is placing children at risk, so removal is necessary. But with legalization, they may be placed in foster homes or kin homes where marijuana is being used. Parenting capacity will be important to assess there, and just not sure where we're to yet. I don't know if there's been any discussions that you've had or through the research.
Thanks for that question. That's a really complex topic, and and I think that will harken back to some of the challenges that we see with the workplaces, whereby these days, especially for initial hires, any cannabis in someone's system means they're not getting a job. And I think at the moment, for a regular smoker who stopped last week, they would still have active amounts of chemical in their system. I think for parents and foster parents and the like, separating out a social use of cannabis versus actively using, caring for children, I believe for all of you that are in child protection, it's going to be a very complicated item, because when I worked in child protection, folks who drank responsibly on Saturday night, who had a babysitter or the kids with grandparents, was seen one way, as opposed to a person who drank while their children were at home. So I believe for you folks in that profession, that aspect of our profession, got a real challenge in terms of actively using cannabis versus having it in their system.
Great. Another person online wants to know if there's been any studies on the relationship between, I know you spoke of it in one slide, between alcohol use and cannabis, and does cannabis legalization reduce alcohol use or increase it?
Thank you. There's a variety of conversations around that. There's a study in the U.S. about fatal car crashes showed often that fatal car crashes among young adults particularly, that they were found to have both alcohol and cannabis in their systems at the same time, quite often in a higher percentage than simply one or the other. I think probably the complexity for drivers will be, I believe, especially for the first couple of years, that drivers who have always felt that they wouldn't drive drinking with alcohol in their system will drive with cannabis in their system. And until there's an abundance of charges, I don't think that will change much. But to answer your question specifically, the articles I've seen are all over the place. I've seen indications that, yes, both are together often, but I've also seen a change in heavy drinking when cannabis has become available, and people will take that as an option some of the times. Wide variety.
Okay, thank you. Another question from a social worker in healthcare. A lot of the clients the social worker deals with does use cannabis for mental health reasons, but see in this presentation that it really should be avoided when clients have mental illness. Any suggestions on how to approach practice in this area?
Thank you. That's probably going to be test a lot of our assessment skills in the years ahead, because I believe as legalization really comes into being and low dose products are available, I believe that there will be an interesting line between acute mental illness and mental unwellness. So I believe that people who have mild anxiety and depression, I believe that cannabis will be promoted as a low-dose option. I know the clients I've had in the past who have not been in favor, felt well with the SSRIs, the anxiety and drug and depression medications, who were past previous cannabis users, would say that when it becomes legal, I'm going back to cannabis. I felt better. So I think that your question is excellent, and I think in the acute phase of mental illness, that will be the most complex part. But I do suspect among a wide variety of fronts for well-being, I believe that will be marketed, and we'll see some movement next year about the benefits or not benefits.
Okay, thank you. So prior to legalization, there seemed to be very minimal supports and groups for THC use as opposed to other drugs and alcohol, as it was viewed as it's just pot. Do you anticipate an increase in support groups once it becomes legalized?
Wow, I hadn't even thought of that one. That's an excellent question. That's an excellent point, because you're right. I until you just wrote that question, I hadn't thought of the fact that I've become so accustomed to seeing other support groups that I hadn't thought about cannabis. It will be interesting. It'll be interesting when you go through your practice over the years if the illegal market responds with high dosed options, whereby people who are able to get through the current, say, street level cannabis and the store-bought cannabis have psychosis or have other issues after using high THC dose products, and then that addiction leading to support. But yeah, I think you're onto something. I think that's probably the next group that we get used to seeing, particularly if the illegal market responds.
Okay, wonderful. Questions are still coming in. This goes back to a previous question, but it's just a little more in-depth question. If two parents are engaging in cannabis use at the same time, are they considered impaired, or will there be a certain amount that need to be consumed before they are considered impaired while supervising children?
You guys sound like social workers. Your questions are so awesome. I think that's going to be a very interesting place to weigh out, because when I've spoken to folks who use medical marijuana, I've said to them, when would you drive? And they say, you know what, I use medical marijuana, I wouldn't drive for at least 3 or 4 hours. So I'm wondering if we'll get to the point of your question, if that were 2 bottles of beer, would that qualify as an okay supervision? I think in a lot of Canada on July the 1st or whatever, we'd say probably it's 2 bottles of beer. We may get to a point of deciding what is intoxicated, what is not capable, and the hardest problem for folks in your work is deciding that. Just like employers will have a very difficult time deciding that you appear under the influence, think for folks interacting with parents, when you have to say, or you may say, or feel compelled to say, you're under the influence and I'm concerned, it'll be interesting to see if a person under the influence of cannabis, how that relates to how you would react to someone who's under the influence of 2 drinks or 1 drink. Sorry, I don't have a real answer, but that's a great question.
Perfect, thank you. From your review of the literature, have you come across anything that looks at the healthiness of edibles versus smoking joint, and would edibles be considered more healthier?
Thank you. I haven't seen much recently on that, but I have over the years actually, back in the day, looked more at smoking cigarettes versus cannabis use, and the extreme difference in the chemicals, the variety of chemicals, but more the unfiltered nature of taking cannabis versus filtered cigarettes and the complexity for people using. So I would say that the edible products deliver only the THC product without the smoke. I'm wondering if in the next year that's where there will be a harm reduction push. Say, if you want THC, it is legal, it's part of your relaxant, go for it, but in the meantime, don't take in smoke while you're doing it. It's interesting to see. I got a feeling we'll see some leanings that way.
Thank you. Another question we had was, currently, can you get cannabis in pill form for pain relief?
I'm not sure about what's going on through Canada. I know I talked to someone yesterday here in Newfoundland, Labrador, who's prescribed medical marijuana, and they're having it not in pill form, but in some ground-out form that's not like the tobacco-looking product. Because when I asked about their delivery of it, they use it actually in yogurt. They put theirs in the yogurt. That was using the THC, low-level THC daytime, and using the CBD. The opposite. CBD daytime and THC nighttime, and they had a ground-up product that could go in a variety of ways, smoothies or yogurt or whatever. But no pill form that I know of yet.
Hey, thank you. This is more of a comment, and I don't know if you would have a comment on this as well, Troy, but this social worker has heard a lot of from the public and clients who are discussing their support of legalization, as they will know exactly the quantities and ingredients and everything that's regulated. So they're showing their support for that.
That's a great comment, because that falls into probably some of the early discussion in 2013, 2014 about harm reduction, which was you can either have it so that a person is getting a variable product, exposed to a criminal charge, and exposed to folks who can offer the next level product, or you can have it somewhere where it's known, it changes the dynamic, and the quantity and the composition is known. So that's a great comment.
Next question. In terms of stigma, what about the stigma and talks around marijuana making people less productive?
That's excellent. I think that will be there, and I suspect that it'll be interesting to see, if like we've seen in some generational conversations these days of the view of the boomers versus the millennials, of this, they're not like us, they don't work like we do. It'll be interesting to see if the whole population as a whole adopts cannabis use, or if it's a younger segment, if the baby boomers get to say they're even worse now than they used to be. I wonder if in the first year or in the second year of cannabis legalization, we'll see a range of products still getting to understand what low THC really means, what it means to have a low dose, and especially around if there's lots of discussion around the mental health benefits. So I agree with you that yes, I think next year we'll hear lots of talk about productivity from a generational perspective.
Thank you. Another question related to cannabis use in pregnancy, and if you can point people in the direction of some evidence around the effects of cannabis use in pregnancy, or where people might go to find some information.
That is a great question. What an excellent question on that paternal side of things. I haven't touched that one. I'm sorry not to. I'm hoping that the Health Canada link. Go see if I can go back. Slideshow. Hoping that the Health Canada link will take you there. But I've not found, I've not seen much on that. So you're just like the conversation on the group, the potential groups in the future. What a great emerging topic. Thanks for bringing it up. I hope that you find something on that, or someone else does. Excellent topic.
Thank you. Someone was wondering if working while under the influence of marijuana, i.e. a microdose, or pre-work lunch period break, etc., would treating the use be similar to, say, for example, someone taking a medication at a specific time? And is it harmful to compare small marijuana use to medication technology? Does that still police the use and people who choose to use marijuana?
Great question. When I've spoken with the medical marijuana users, they actively use medical marijuana throughout the day, small dose in the daytime and a dose in the evening. So I think the jury is out on that. But I know the folks. I've spoken to several folks recently in preparation for this presentation, and the folks who use medical marijuana that I've known over the years. They treat it as you've indicated, they treat it because they know the quantity and they know the amount they're taking. They treat it like they would take a pill in the morning. And I think if that's the case now, where people are using a ground-up product that's weighed, I think if that comes in pill form or a known THC written on a capsule, the folks I've spoken to who don't like how they feel under SSRIs or anxiety medication fully intend to use cannabis to replace their day.
Thank you. Still some more questions, Troy. We got some more time, so I guess we'll keep going. Someone wants to know if there's any physical problems that people may experience when using cannabis.
There's nothing overt that I find in terms of I think it's more on the other end of the current illegal products that are high dose, or in the new times, the new illegal products that are capturing the market of higher dose. The 2007 article in The Lancet that just showed the link between cannabis use and psychosis really marked the fact that for whatever the number was, 2 in 100 or 3 in 100 people will have a reaction to just the way they're built and their body chemistry. They will react. So there is that one, and I fear, I guess, that if the illegal market tries to corner the market with high dose, you'll see more of the mental health side of things. I haven't seen much. I haven't looked into much, to be honest, about the physical health side.
Wonderful. Someone else just wants if you have any tips or ideas of how you would talk to other professionals that don't quite feel comfortable with the use of recreational marijuana when it becomes legalized.
Thank you for that. I think that's a great question. I do honestly believe that we are the they out there these days. I think that we have the opportunity probably to be the bridge from where people were, from where people are going. People are going with this. I think that I think some of the links on the screen right now will really take people to understand a bit more about the whole package. But I think it's the hardest thing which you may get to or may not get to is having people examine their own biases and figuring out how they feel comfortable approaching this topic, how much they're willing to learn about it, and are they going to be able to present themselves to their client base to show openness and understanding the full range of, just like alcohol, yes, you meet a friend for a glass of wine, but you can also have a major workplace issue or life issue from getting drunk. But I think the bridge is information, but for other professionals that are not social workers, is examining their own perspectives and knowing that the person in front of you who says, by the way, I use cannabis, they're not asking for a judgment of that. They're probably just stating a fact that might be entered into a case note.
Perfect, thank you. You may not have information on this, Troy, or maybe where to point people to, but someone asked the question of how does cannabis use interfere with prescribed medications?
Excellent. I believe the jury's out on that one, to be honest with you. I've been looking for some articles with that, especially I've wanted over the years to find out how cannabis use relates to folks who are on antidepressants. I'm looking for that through the years, and I haven't found anything useful for me to be conclusive. So my clients in the past have said, I'm taking Prozac, and I'm also smoking joints. Like, is that good? Is that bad? And not found enough so far or ever really pointed me to a clear line. But I'm hoping that as this becomes mainstream, that's the kind of information that we'll all have in terms of being supportive to our clients.
Okay. Thank you. Another question is, how much THC must be consumed before it triggers drug-induced psychosis?
Great question. I don't think the folks I've seen over the years in my practice, it's been so variable, but I think that up until now, every single use, people have gotten a variety of THC. And I wondered before, when I've had past clients who've developed psychosis, I've wondered, is that them? Is that their makeup and that just happened to be their time? Or did they get a particularly potent stream of THC that just triggered a drug-induced psychosis? But I'm wondering if we get to see Canada, if you saw earlier slides, I showed one called Girl Guide. Wrong slides. Oh, sorry, backing up there. Go ahead. I'm getting a net to find me a slide. Yeah. So the one on the screen right now, like, I'm wondering if we're going to get there in Canada, where there's this open market, which is, sure, you want 10% THC, here it is, but also you can get 28%. Or I'm wondering if we're going to see a cap. Cap is 10% or 12%. And that is to mitigate adverse health effects. So I believe that's the jury out on that one for this coming summer and fall is, what is the market and how high are we going? Are we doing, 5%? We do 5% alcohol, but we also do 40% rum. Are we going to go there? Great question, but I think the jury's out on that one.
When the question was asked around the cannabis in pill form for pain medication, someone did write in and say, yes, cannabis oil can be placed in the pill form, and capsules can be ordered, and the patients put the prescribed in the capsules. That's great information. Yeah, thank you. We're nearing our end of our time, so maybe a couple more questions. Just to get your perspective, Troy, if cannabis is safe enough to legalize, were the past concerns overstated, in your opinion?
Yeah, that's a tough question because they probably were. There probably was a control measure that was a control measure that, if we really dug into it as a bunch of social workers and looked at what was going on in America in the 1960s and 70s, we probably could consider that the idea that marijuana was a gateway drug strongly entrenched. And I've looked for a few articles on that, but I did see an article in the U.S. recently that suggested that there was no evidence to really show marijuana was a gateway drug. So all that sparked the war on drugs, the cultural reaction to the 1960s, 1970s, I'm wondering if that drove things in the U.S. and in Canada. But I know that through the 1980s, particularly into the 1990s, the idea of a gateway was alive and well, and once that concept was put there, people just sort of accepted that was the concept. It is a gateway drug. It is what it is. It exposes you to others who use. So I'm wondering now, when we see that what we really may have done is expose people to folks who deal in other drugs. We've exposed them to criminal charges. We've set them up in terms of their family dynamics. Maybe that the cost has been extremely great, and now we're switching over to a point of harm reduction, which is this is probably a product with harms and benefits, just like alcohol. Come to its time.
Okay, last question, I think, because we're getting short on time. When someone seeks treatment for cannabis use, what tends to drive that decision?
Thank you. Almost entirely. I think in my career, I've only had a couple people really who've had especially people with some beginning personality or mental health concerns that they've told nobody yet, and they've said, I really need to cut back. But the vast majority, if I've examined their belief, many people said, I'm good with this. I'm good, but I've got a job in Alberta and I need to go. And I can't stop it, by the way. I wish I could, but I can't. I need some support in reducing and eliminating. That's what I need next. Or folks who say, you know what, I love it, but I just can't do it. If I get caught at work, I got a family to support. So overwhelmingly, I have over the years had people who've come solely to say, I never thought I'd be saying this, but I believe I'm addicted to marijuana, and I need to change. Most has been linked to another driver, quite often.
Well, thank you so much. Thank you, everyone, for all those questions. I'm sure we could keep going for another half an hour. Unfortunately, our time is coming to a close. But I do thank you all for joining us online today and also those great questions. So I do want to take this opportunity to thank Troy for this outstanding presentation and certainly for sharing his knowledge, experience, and expertise with us today. And I always believe that as social workers, it's so wonderful when we can come together and celebrate the profession during Social Work Month, but also to learn from one another. And this session allowed us to reflect on the upcoming legalization of cannabis and the impact on our practice. And it's certainly very fitting with the theme for 2018 Social Work Month of bringing change to life. We know that the landscape of cannabis use is going to change, and by us becoming better informed and having these conversations, we can build our own knowledge and competencies and respond in a manner that engages clients and supports best practices. So thank you again, Troy. We truly appreciate that you were able to lead this national webinar today. Again, just for folks online, the recording of this presentation and the slides will be uploaded to the NLASW website and CASW website for your future reference. For those who've attended 75 minutes or more of this presentation, confirmation of attendance is available now by clicking the yellow icon button at the bottom right of your window. And I also encourage everyone to complete the evaluation form as well. So thanks again, everyone, and happy Social Work Month. We're at the end of the month, and a great presentation to take us out of Social Work Month. Anyway, everyone, take care and enjoy the rest of your day, whatever time zone you are in.
Have a great day.